evening and welcome to another informative, exciting episode of Health Check. We're coming to you live from the nation's capital, Hope TV, where you look and live. My name is Carrie Kagiri, and today we talk about some of the professions that you don't hear often, but you must know about. It is a pulmonologist. I hope I said it correct. I've been practicing for the past hour. And we have a pediatrician, and we're talking about pneumonia in children. It gives me pleasure now to welcome our guests who made themselves available. And it is boy child versus girl child in studio, and it's fine. You can check us out on Facebook. We're live on Hope TV Kenya and on Twitter at Hope TV Kenya as well. Karibuni sana, and thanks for joining us.
Thank you.
Thank you very much.
I can see your faces now. You know, they only removed their masks when they got into studio. I was like, I need to see the face. Now I can see it. Karibuni, and just a quick introduction of who you are and what you do. Let's start with you, sir.
John Wachira is my name.
Uh-huh.
I'm a pediatrician. Yes.
So doctor.
Yes, Dr. John Wachira.
Okay.
I'm a pediatrician. Yes.
Okay, that's good. And what do pediatricians do? There are people who are watching who are like, pedestrian.
Pediatricians are not babish. They're not childish doctors. They're just doctors who take care of children.
That's so nice.
From when they are small babies to when they become like small adults.
Small adults.
Yes, like that's from 0 to about 18, 19.
Okay.
Yes.
That's really good, because last week we were talking about maternal care,
Yeah.
and now we left the baby coming at home. So you're the guy.
Yes, yes.
Okay.
Yeah, we work with families to take care of children from when they're young, and then when they're ready to form their own families, we release them back to the family.
Okay.
Yes.
And on the very extreme left, pink is the new black. Karibu sana.
Yeah, I got the memo.
Uh-huh.
My name is Dr. Waweru.
Yes, sir.
I'm an adult pulmonologist.
Uh-huh.
I am glad you got the name right.
Thank you, sir.
And what I do, I take over from him as far as just issues are concerned. Anyone from the age of around 12, 13, we co-manage. When they reach 18 to 21, depending on the jurisdiction, then we take over.
Okay, that's very interesting. Before we go into childhood pneumonia and all this, let's talk about COVID-19 a bit. We cannot ignore the fact that it has brought a lot of fear, anxiety, and the word pneumonia kind of surrounds COVID-19. Can you speak on that and just how it's affected you this season?
Let him start.
Okay,
It's
sure.
been adults who are affected.
Really?
Children are not much affected. They are affected, but not directly.
Okay.
Not as many. Yeah, let's start with him.
Sure.
Yeah,
Sure.
COVID-19 is a new disease. New in the sense that the virus that is causing the disease has changed from the older coronaviruses that we have had in the past. Indeed, in January, we were still diagnosing coronaviruses, but not the specific coronavirus that causes COVID-19. So it has come in and it is causing havoc. As you can see, huge numbers of people who are dying, especially people who have other underlying conditions,
Yes.
like people who have had lung diseases in the past, asthma, chronic obstructive pulmonary disease, elderly people with diseases which lower immunity, such as diabetes, HIV, and so on.
Yeah.
So COVID-19 is here with us. It's still in the growing phase. We are waiting to see what will happen with it. The connection with the lung is that it causes pneumonia. And basically what that means is that the lung reacts to this germ. The germ causes damage, and the body reacts to the body's immunity reacts to the germ. Unfortunately, in some individuals, this leads to severe damage of the lung, which reduces the ability of the lung to pass air in and out as it should, and this can cause severe disease and unfortunately death in some people.
Yeah. But we are taking all the necessary measures, and we hope you too are. Stay clean, ensure you don't come in contact with this virus, stay at home, reduce the amount of contact that you are having, and just follow and cooperate with the government. They're here for our very best interests, and everything will be fine. I believe that. Let's talk about childhood pneumonia. Daktari, just explain it to a parent that is completely clueless.
Maybe let's start off with why are we talking about pneumonia here and in the world? The bad thing is that children are still dying in Kenya, even away from COVID-19. And every year we have very many children who die from pneumonia. If you take children who are below 5 years of age, if you take anybody's lifetime before, of course, they become old enough, if you take anybody, the highest group of people who die is in the first 5 years of life, those who die prematurely. And one of the biggest killer is pneumonia. It is estimated that out of every 20 children who die in Kenya below the age of 5 years, 3 to 4 of them will die from pneumonia.
Wow.
Yeah, and if you take actual figures, we are talking about figures of between 20 and 30,000 children dying every year from pneumonia in this country. Much more than what COVID-19 might actually take. Now, away from that, if you take those who are admitted, if you take those children who are get to hospitals beds, as many as between a third to half of the children who will be in the ward will have pneumonia, or will have pneumonia plus another disease. Like those who have HIV, they'll have HIV plus a pneumonia. Those who may have other conditions, underlying conditions, they may have the underlying condition with a pneumonia. If you go to ICU, the children who end up in ICU, they'll have an underlying problem, and about half of them will have a chest infection or maybe a pneumonia. So pneumonia contributes to a big burden in Kenya and in Africa. The sad story is this is not the same figure that we get when you go to the so-called developed nations. Not so many children die of pneumonia in those countries. And why is because there's a big part of pneumonia that can be reduced in terms of admissions, illnesses, and even deaths. And that's why it is important to address pneumonia as it is.
Let's ask the question, why?
Why we have so much pneumonia in the country? One of the simple reasons that children are forgotten. If you go to the history of in the hospital in this country, they will have a big adult side and a small children's side. If you look at the population of Kenya, you have a big children population and a small adult population. So the resources are not allocated in proportion to the population.
Okay, Dr. Peter, do you agree with that?
I do agree with that. In fact, I can quote him. In 2018, he had written an article in one of the newspapers, and he had talked about very basic things. One, diet.
Yes.
Many children are malnourished. And malnourished does not mean just missing a meal or two in a week. These are children who are not having adequate food continuously for their childhood. Number two, difficulties in getting those children vaccinated against the common diseases. You see, things like measles may end up causing pneumonia. There are many other germs for which we have vaccines, but children are not getting vaccinated for various reasons. Poverty is one of them. You find a mother living 20 kilometers from the nearest health center. They can't afford. We live in a 100 shilling a day kind of environment. So even if the mother is aware they can get a vaccine, to get on a boda or a matatu to go to the nearest hospital becomes a big problem.
Yes, and it's a lot, especially when the child is small, so you have to keep going
several times, yes, to the clinic. So vaccination, poverty, malnutrition, these are common things which affect children. And then some of these things are easy. Like now some children will have low vitamin levels, different types of vitamins, because they can't afford fruits, they can't afford specific foods that provide those vitamins. You'll be surprised some families, they sell the eggs and buy Lucozade for the sick child. So it becomes quite a strange thing, you see. And sorry for using the word Lucozade, but they'll buy things like those, which eventually end up harming the child rather than helping the child.
Can we have more causes from you as well? What can cause pneumonia in children?
Okay, pneumonia as a disease.
Yes.
We're talking about being caused by germs.
Okay.
And these germs are either bacteria, virus, or parasites. The biggest proportion will either be bacteria or viruses.
Yes.
And those are the ones that can end up in hospitals. Very few of them will be parasites. Yeah, there are many names to the pneumonia. What is important about those names is that some of them have vaccines. For example, when you talk about pneumococcal or strep pneumo being one of the causes, there is a pneumococcal vaccine that is given for that. When you talk about Haemophilus influenza, there is a vaccine against that, which is a combination. So that some of the names are good to know because they have vaccines against them. But the others which don't have vaccines, that are specific for them. Yeah, that is that. Then of course now those are the bacteria. Then you have viruses also that can also cause pneumonia. Yeah.
Including the coronavirus.
Including coronavirus, yes.
Okay.
And yeah.
But you've specifically said that it is rare for it to affect the children.
What we say is that corona is a relatively newer disease, the way it is. So we can't conclude its figures and numbers here, but we can say that what other countries have reported, the China, the European, the American, and even now the Kenyan state, we'll have 208 something people in Kenya having the disease, and less than 10 of them being children. So that in that sense, we have fewer children who are affected. They can get infected, but not many at the moment.
Signs and symptoms when I meet someone or when I'm having someone in the house. What are some of the signs and symptoms? And we can start with you, Dr. Peter.
Yeah, I'll just add a little bit about pneumonias in adults because I'm an adult doctor.
Please.
Yeah, so the way we look at it in two ways. There are pneumonias which are caused by infections, and those are the viruses and the other bacteria.
Yes.
And we also have a group of pneumonias which are not caused by infections in adults, even in children. And it is important for this distinction to be made because you may find a person having a non-infectious disease being managed as if it's an infection, and that also can cause lung damage and death. Now, coming back to the signs and symptoms of pneumonia, because it's affecting the airway and the lung, what we find frequently is people who have cough, you have fever, you have chest pain, and characteristically when they take a deep breath, the chest pain worsens, what we call pleurisy or pleuritic chest pain. Depending on how long the pneumonia has been there and how severe it is, they may have severe difficulty in breathing, they may cough up blood, they may cough up different amounts of sputum of different colors. They may also start losing weight, sweating a lot at night, especially in those pneumonias which are lasting a bit longer.
Yeah.
So when we assess a patient and we find this constellation of signs and symptoms, then we will suspect that this patient may have a lung infection or pneumonia.
When you've spoken about that, it's just got me thinking about tuberculosis, and it's something the Ministry of Health is talking a lot about right now. I don't mean to digress, but what is that difference?
Yes. As we mentioned, pneumonia is an infection of the lung or inflammation of the lung.
Okay.
And that can be caused by many things. Tuberculosis is a type of bacteria. So it falls in that group of germs which can cause pneumonia. So it's key to differentiate, is this the usual bacteria or is this a bacteria with a difference like TB?
Wow.
Yeah.
Okay, so they're all related, and that's why the symptoms and the signs are very similar
yes.
for children. Well, how do we tell?
The World Health Organization has tried to define signs of pneumonia so that anyone out there can be able to identify it. And we use 3 signs plus 1 or 3 signs plus 2.
Okay.
Basically, any child who has cough or difficult breathing and fever, any of those 3 altogether, then should be assessed for pneumonia. If a child has cough and difficult breathing and fever, then that child needs to be assessed for pneumonia.
Do you write like C, D, F? Cough, difficulty breathing and fever.
It's part of what is done in training.
Okay.
Yeah.
You're welcome. All WHO, you're welcome.
Yes, and then now if they have any of those, then they have fast breathing, then WHO would say go no further, start treating for pneumonia.
Okay.
If they have cough, difficult breathing and fever, and then they have chest wall indrawing, their chest is much is much more movable, unlike an adult's chest. You'd see the chest moving in and out and with a bit of indrawing on the lower side. Then that child, WHO would say don't do anything else, just go ahead and treat for pneumonia. Why that is done is to help capture as many of these children as early as possible and start treatment, regardless of whether you have an X-ray or you can do blood works or not. Of course, where facilities are available, and you're talking about now Kenya in 2020, we have a little more facilities, so there should be more tests done to check whether it is bacterial or viral.
In your experience, how has that, is that what you do, and has that been the case through and through?
Maybe an easier way is to look at studies that have been done to check how well pneumonia is diagnosed, and depends on where somebody goes. Okay. Most of the doctors trained in medical schools have been trained well to pick that, and as well as most of the clinical officers, are also trained to do that. So it is pretty easy. Anybody who goes to a good health facility where there is a trained person, they are likely to pick the pneumonia is well picked. problem comes in when people say of treat.
Yeah.
Maybe we'll talk about that later. When people say of medicate that cough, that running nose, or whatever it is that they have, then they are likely to bury the pneumonia and then present late.
Wow. So like I should stop taking all those antihistamines.
We're talking about children.
Children. So adults, we are safe.
No, we talk about them in a okay, Dr. Bonyo is in the room.
Just checking. The children are taken care of by parents who also need to be taken care of. These causes, we hear vas sweater, don't drink cold water. What are those risks? And how can we avoid?
Now, in adults, the risks are not wearing a sweater. No, this is a joke. Now, the real risks for pneumonia are anything that, one, exposes a person to the causative organism. For example, if you're in a room and someone has COVID-19, for example, you are likely to get exposed to that. It goes into your system and cause trouble. Similarly, if you're sitting in a room with someone who has TB, you are likely to also get exposed, and so on. The other risk factors are anything that reduces the person's ability to fight infections. And here we are talking about diseases like HIV, cancer, diabetes, and so on. We are also talking about medication that people take. Some people are treated with medicines which lower immunity, especially people who have diseases like cancer, connective tissue diseases, things like steroids, people who use steroids. Those people are predisposed to get these diseases. Then the extremes of age. John here has already talked about children and the huge numbers that they see. We also see big numbers in people who are older, and therefore the immunity has somehow gone down. Then there are certain procedures that doctors may do which may predispose people to getting pneumonias. For example, if one goes to an ICU and they get tubes stuck down their throats and other places, then that person is unlikely to be able to cough enough. The tube itself will be colonized by germs, and they can end up with a pneumonia, even if they went to the ICU with a different condition.
Yes. Okay, let's talk about in children. What are some of these things that increase the risk?
The risk factors in children are, if you start off from birth coming up, those children who don't get their vaccinations, because vaccines do reduce the risk, do improve immunity. The second thing is children who don't breastfeed enough. If a child when children breastfead, they actually get the antibodies and the immunity boosted. So those who don't breastfeed enough, they are put at risk of pneumonia. Nutrition. What we find in this country and much of Africa as it is that many children suffer from micronutrient deficiency. That means they don't get enough vitamins and minerals and other nutrients. When they don't get that, then their bodies are weak and they easily get the pneumonias. The third thing is overcrowding. If children are in a place that is overcrowded, then it's easy to transmit it from one child to another one. Again, environmental. When you have got somebody who is smoking in a house, in a home, in a neighborhood, then they are likely to affect that child. That smoke is likely to weaken the child in some ways. Even the firewood that is used and all that in homes, that can also put children at higher risk of getting the pneumonia. And then underlying diseases, when they have got HIV or diabetes or other heart conditions, or other underlying problems, all those can put a child at higher risk of getting pneumonia. Those are some of the risk factors.
If you just joined us, we are talking about pneumonia and in children, but we also do have an adult pulmonologist. I've said that right, I'm so proud of myself, so I'll keep saying it. Dr. John Wachira, who is a pediatrician, and I feel like, are you a specialist in pneumonia in children? Is this your forte?
No, my area is pediatric emergencies.
Okay, but you're so passionate about it and you even wrote an article about it. So that's really good to see that. And Dr. Peter Munyu, who's a pulmonologist. Wow. Okay, fine. Our text line is 22232. You can send in any of your questions. You'll also be getting an opportunity to call in and make those questions live to the doctors. It's consultation. It's absolutely free, only on Health Check. So take advantage of it and find those questions that you may have to ask. Let's see, how long does it take a child to recover from pneumonia?
Normally, it's very hard to say this is the entry point when a child got infected. But most of the diseases, as you're seeing with COVID-19, most people when they're exposed, it'll take about 1 to 2 weeks to develop the signs and the symptoms. Pneumonia, the bacterial pneumonia tends to grow to develop very fast, and then you can leave a child well at home and be called in the afternoon. Child is having fevers, and by evening they're having problem with breathing, and the following day they are looking very sick. And if nothing is done within 48 hours, 72 hours, you may find them dead. That is how fast pneumonia kills. And anyone who anyone who has had a bad experience of any family that has lost that, they know the story.
That's true.
That child was perfectly well, and then they just got sick for 1 or 2 days, and that day they are gone. So that's how fast it kills. Having said that, it also responds to treatment equally fast. Within 2 to 3 days, the child is up and about. Yeah, but generally most of the treatment will take about 7 to 14 days, and then the child will be well.
Okay.
Yeah.
Dr. Munyu, this chest, you have a really good idea of how the lung looks like. Can you just give us a visual of what it takes to actually get pneumonia?
Okay. We have already alluded to the fact that for most infectious pneumonias, you need a germ, and that germ gets into the airway.
Yes.
Normally, we have very good defense mechanisms to prevent those germs from reaching the lungs. And these defense mechanisms include things like cough. When you get something in your airway, you'll cough.
Yes.
Sometimes the germ is in your nose, so you'll sneeze. We also produce some mucus in the airway, which tends to trap these germs.
Okay.
And this mucus does not just trap germs, it contains certain chemicals which also work in terms of destroying the germ.
Okay.
Under that mucus in the airway, we have certain specialized cells which are also trained by the body, by the immune system, to fight these germs. So by the time the germ reaches the lower part of the airway into the lung tissue, it has had to bypass all those defense mechanisms. And then in the lung itself, the germ has to overcome the local defense mechanisms and as well as systemic defense mechanisms. The local defense mechanisms are cells which are spread in the lung, which are waiting for any germ so that they can destroy it. These are the white blood cells generally. And there are also some which are floating within the blood. And when one has had an immunization, there are certain chemicals we call immunoglobulins which are produced which fight the germs.
Okay.
It's a very interesting battle that goes on
it's
to
a
try
war.
and
By
keep
the
us
time
well.
it gets to pneumonia,
Yes.
your body has really worked.
Yes, and therefore, for us to get pneumonia, one, you either have a very, very virulent germ, a germ which is very, very bad, very stubborn, so to speak. And secondly, you have a failure of all that system. And the failure of the immune system can be due to diseases we have alluded to,
Yes.
like pneumonia, diabetes,
Yes.
HIV, and so on. Remember, some people may not cough for different reasons. We already talked about tubes down our airway.
Yes.
But remember, this person who is smoking, what does the smoke do? It damages that protective lining in the airway.
No.
And also they produce mucus which is not as well protective as in the person who is not smoking. Remember, this person who has drunk, and therefore if he falls down and something goes into the airway, he does not know or does not remember to cough.
Yeah.
So even excessive alcohol consumption can affect the way that mucous membrane is working, your cough reflex, and that can predispose you then to developing pneumonia.
Wow. So in adults, let's talk about this in adults. What is the treatment process as well, just like he's explained in children?
The key thing is to make a diagnosis.
Yes.
Because a diagnosis will help you select the right medication. Because as he has discussed, it can be viruses, which require different types of approach. It can be bacteria, different approach. It can be other things like TB, whose treatment is different. So generally, when a patient comes with the symptoms and signs we had discussed before, there is room for starting the treatment as you wait for your investigations.
Okay.
And investigations in this case, which will help you confirm the pneumonia and decide or make a decision on what germ is causing, will involve doing x-rays, and the x-ray can show you the pattern of pneumonia within the lung, and that may also give you an idea of what germs are causing that pneumonia.
Okay.
We can also assess the sputum, and here we can do either tests which try to grow the germ, or tests which check the DNA of the germ,
Okay.
what you call PCR tests, so that you can identify the specific organism causing the germ. Sometimes you have to do things we call CT scans. These are even better than X-rays, but they have more radiation. And we also do things called...
See the thing that goes on?
Yeah, like that, and then it takes very good pictures.
Okay.
And we may also do cultures. Cultures are tests where we try to grow whatever germ is causing the disease.
Okay.
So you take the sputum, take it to the lab, they put it in culture to try to grow germs like bacteria or TB germs and other types of organisms which may be found in a person who has pneumonia.
Dr. Wachira, these various complications in children, what are some of the common complications that pneumonia causes in children?
Of course, now that's affecting the lungs. When it's a minor disease, you're talking about somebody who is walking around and all that.
Yes.
When it gets severe, you mean somebody whose oxygen levels are reduced. And when oxygen levels are reduced, it means all organs are slightly are likely to get affected. And that's how it kills, because you reduce oxygen flow to the brain, to the kidneys, to all the organs, and then they eventually shut down. Specifically to the lungs, you may have a progression from the simple pneumonia to the severe pneumonia to have lung filled with pus. Have a pus, a lung that is full of pus, and then that could also now spread to the blood. You end up now with blood that's mixed up with pus, or blood infection. You may end, and that can also go to the brain. You end up with the meningitis, and that so that is all those are
A ripple effect, of course.
A complication of the pneumonia as it is in children.
Wow. Okay. When I was trying to do my research, I saw sometimes pneumonia can cause the lungs to be filled with water. Is this in children, in adults? Maybe you can respond to that.
Yeah, it's something which there are two types of waters, if I may talk about that.
Yeah.
You may let's use the word fluid.
Okay.
You may have fluid within the lung tissue itself, and that's the bogginess that you prevent air from passing from the airway into the bloodstream. That is one aspect. But you also have an aspect where there is water accumulating between the lung and the rib cage, what you call a pleural effusion. That is free fluid floating between the lung and the rib cage. And the management of this varies. When it's just fluid within the tissue, antibiotics generally will sort that problem, unless you get a pus collection, in which case, in some rare cases, you may have to drain that pus within the lung. While the fluid collects between the ribs and the lung, it depends on how much it is. Most pneumonias, you have very tiny amounts of fluid collecting between the lung and the ribs, and we do nothing about it. By managing or treating the pneumonia, you sort that problem out. But in some instances, the fluid is so much that it starts compressing the lung, and therefore, in that case, just giving antibiotics will not improve the breathing. And sometimes you have to put in small tubes between the ribs so that you can drain that fluid and allow the person to breathe normally.
Wow, as we're learning that pneumonia, is this disease caused by germs, which are viruses and bacteria mostly? There's something else you
That's
added
correct.
that affect the lungs. And it's been so many times that you've heard, of course, someone went to hospital for a certain case and ended up dying of pneumonia. So it's good to understand what this is. It's not about baridi, it's not about all these other things. It's actually something that maybe will reduce with the new cleanliness and health regulations that we are having during this COVID season. What do you think?
Yeah, it might be one of the good effects if we maintain it.
Okay, let's talk about the treatment.
Treatment will depend with how a patient comes in. The World Health Organization has developed guidelines for treating children with pneumonia because most of them are fairly straightforward. Most of them, we tend to err in treating bacteria, even when it may not necessarily be bacteria, and more so when you don't do the test. You're talking about public hospitals out there and other health facilities where there may be limitation of resources. When in such settings, then any child who has the cough, difficult breathing, the fever, fast breathing and chest all in drawing, the World Health Organization would put in an oral antibiotic.
Okay.
Tends to be more of penicillin where there are no allergies. Then if it becomes severe, there's now a child who looks sicker than that, then they would add a second antibiotic. They would actually combine two antibiotics, or if they have used any of those first line antibiotic, then they'll go to what is called second line antibiotics. That is on antibiotic use. But this patient, this child is not just having a bacteria in the lungs. This child came to the hospital because they were having fever, so that fever, you need some medication to treat that. This child came in because they're not able to feed, so they need support in terms of feeding. Some of them will just be supporting them to feed in small amounts. Others may go into putting a tube through the nose into the stomach. Others may need an injection, a drip for the feeding. So that is support on the feeding. Again, the pneumonia affects lungs and affects oxygen flow in the lungs. So you may find this child's level of oxygen low. So they will need some supplementation or some additional oxygen that may be given by a tube or be given over a mask, or in worst case scenario, they may be end up in ICU on a machine to deliver that oxygen. All those are supportive treatment. And any other problem that may be there. Some of them may be dehydrated, so they may need a drip just for the fluids. And if they have other complications, then that's done. Allow me to say that some of the pneumonia are caused by viruses, and those ones don't need antibiotics. In some cases, some of the pneumonia, like when you have got HIV, then there will be special treatment that will be required, not just the antibiotic you have talked about. And also, when you have got some underlying immunosuppression, maybe a child who was on cancer treatment or other treatment that may have weakened the body, then that child may be having a parasite causing the pneumonia, and they will require antifungal medication as it is. So that the treatment will depend with the underlying cause, and then the other half will be supportive care.
So these hospitals that you're talking about that don't have all this technology, how do they get to know whether it's a bacteria, a virus, a fungi? Is there like a litmus test? I don't know.
No, World Health Organization errs in saying treat them as bacteria if they are severe enough to require admission.
Okay.
Yeah. But even to minimize overuse of antibiotics, then there is need to do some basic tests, which eventually are getting the county governments are working hard to make them available.
Yes, I hope so. And any support you guys can give, please go ahead and do that, because you don't want to be tested to be, giving medicine for the wrong thing, but it still all saves the life, right?
Yes.
Okay.
Actually,
eventually.
What I'm calling WHO guidelines, they're actually Ministry of Health guidelines adopted in Kenya.
That's good. Let's talk about it a bit in adults as well.
Yeah.
The treatment. Someone checks in, is it the same? We didn't confirm this. Is it CDF still?
We still look at the same signs and symptoms.
Okay.
Now, once we have confirmed that a person has a pneumonia, in the first instance, your decision for the type of antibiotic or whatever other medication you will use will depend on the data you have obtained, the X-ray, what pattern you see there, the blood test, what pattern you see there. If you are able to do a sputum test, what type of germs you are seeing there. That will help you decide what initial antibiotic you will use while you wait for the second line test, which you call culture, which will help you determine in a better way, one, what germ it is, and secondly, what antibiotics it is likely to respond to. Antibiotic misuse has led to a situation which you call antibiotic resistance, where you may have a very straightforward germ, but it has been exposed to so many antibiotics that it has developed resistance. So that's why it is sometimes necessary to go to that extra step and do a culture. Now, as you decide your treatments, you also have to look at your patient in terms of what are the other underlying problems this patient has. Does this patient have allergy to any of the medicines you may want to give? Does he have any underlying immunosuppression? For instance, if a person has HIV, which is not well managed, there are certain germs you must think about which may not respond to the usual first-line antibiotic. So these are some of the things that we think about. Has the person recently been in a hospital? Because by being in a hospital, one gets exposed to germs which are more likely to be resistant. Has this person used antibiotics in the recent past? For instance, in the last 3 months, has this person used an antibiotic? If they have, then you are likely to choose a higher level antibiotic than the baseline. You also look at how sick is this patient. Will this person give you time with the first line medication? And there are different scoring criteria we use to determine, one, is this a person I can safely treat with oral medicines? Is this a person who needs an IV medication? Does he need a combination of antibiotics? So there are certain guidelines which you use, which you guide us what to choose for that patient.
And I encourage us to cooperate. When you go to hospital, let me just speak as a patient. I'm here, I'm having pain, I'm coughing, I just want medicine. You start asking me, have you been to a hospital? Have you been taking medicine? What medicine have you been taking? Where have you been? So it's good to ask those questions just to predetermine. So next time you go in, please cooperate so that the doctor can have the right information to know how to treat you and what exactly you're being treated for. We are vaccinated as children, and children who have been vaccinated, how do they still end up getting pneumonia? Other than, I think we really talked about this, but let's do it again.
Mm-hmm. Yeah, the good thing is that the government has vaccines available for all children born in Kenya, and they are given their vaccines from birth. Then they move on at 6 weeks, 10 weeks, 14 weeks. Every month there is a vaccine for the first 3 or 4 visits. Those vaccines, they all cover for pneumonia, what is called pneumococcal vaccine. They also cover for H influenza, another combination of the vaccine. And then they also cover for other bacteria that would also affect the lungs, like diphtheria and pertussis. So all those vaccines do prevent those types of pneumonia. As we said earlier, pneumonia is caused by many other bacteria that are not covered by the vaccines, and therefore, if one, even when one has been vaccinated, they can say if they get exposed to a different pneumonia, like say mycoplasma, which you don't have a vaccine for at the moment, then they will get the pneumonia.
Okay.
Or if they get viruses, then they will get a viral pneumonia. So it's possible to get pneumonia even when you have been vaccinated. But the good thing is that from when Kenya started vaccination, our pneumonia figures dropped. Yeah, our pneumonia figures dropped, largely. Those who are getting admitted and those who are dying from pneumonia. So the vaccines have reduced the death and the disease. Yes.
Just a question on that. You've talked about, I've remembered, most of the crisis mothers face when they leave hospital is going for the vaccine. There's an expensive vaccine that has Calpol, or I don't know what they call it. And there's this other affordable vaccine. Can you just speak into that?
What happens is that the disease medicine changes.
Okay.
If you have been looking at the COVID, for the last 3 or 4 months, there are like 5 or 6 or 7 lines of treatment that have been tried by different countries.
Okay.
And to test any drug, any vaccine is a huge cost. And therefore, the newer a drug is, the more expensive it is. The newer a vaccine is, the more expensive it is. So if you have got the pneumococcal vaccine that was initially developed, say 20 years ago, it may go for let's say 200 bob. But if you have a newer version of the same pneumococcal vaccine that was done like 10 years ago, it will be 2 times or 3 times or 5 times that cost. If you have one that has come up in the last 5 years, because of patency and the cost of research and the cost of trials, then you may have that vaccine will be much expensive.
Okay.
Yeah, so people talk about baby friendly, but that's not usually the thing. The thing is that it's a modified vaccine.
Wow, that's good information.
It's a newer vaccine. It's a vaccine that has been improved on efficacy, how effective it is, and how safe it is to the child. Yeah,
I like that. In adults, same question. We have gone through the treatment. It's the same kind of viruses that still affect adults.
Yeah.
Okay.
What happens is that with most of the childhood vaccinations, the immunity is long-lasting.
Okay.
In adults, there are 2 main germs for which we advocate vaccination. One is the pneumococcus, and this one we usually recommend to people who have underlying lung disease and anybody who is above the age of 65. Then we have the influenza vaccine, and this one is the pneumococcal vaccine is there's a protocol for it, but most times it's given once or twice, and the person is set for life. But with the influenza vaccine, the influenza virus has certain characteristics in that every year it changes its immunologic presentation, and therefore every year it's a new virus, so to speak, and the body's immunity may not recognize it, and that is why we talk about annual revaccination for the influenza virus. Yeah.
Okay. Wow. Your questions, they are coming in on 22232. When we start on the question and answer session, we'll just flow with it. So send in all your questions, your comments, anything you might have, and we will be opening that line even as we continue. We've talked about the diagnosis. We've talked about the treatment. The treatment leads to a cure. You can completely recover from pneumonia.
Yes, if caught early, and you have the right diagnosis and the right treatment, and the body responding well, then most of people will get cure. But there is what we call treatment failure. You may actually put someone on the correct treatment and you have the correct diagnosis, but then the treatment fails. And that's why there's need for follow-up. Anybody who gets treated usually will need a follow-up. They will be given a review after a week or 2 weeks for the doctor to check whether they have healed well. So there is some treatment failure. In Kenya, is as many as a third of those who come with severe pneumonia. They can have some failure, and that means there is need for follow-up, and then see why they didn't respond. And Peter did explain why you need to do many more tests, to find out what's happening, and all those reasons can lead to failure of the treatment that was given. Yeah,
we're about to go on a break, but I think I was in the spirit because someone texted in and asked, can pneumonia recur after recovery, and is it contagious? So you can wrap up with that as we...
Yeah, pneumonia can recur. It can recur either the same germ affecting you again. For example, if you are treated and the bacteria was just partially responsive to the medication, you may appear to improve, and then a few days to a few weeks down the line, the disease comes back again. Or you may be treated, you completely cure, but in future you are exposed to the same germ or a different germ, and your lung can get reinfected. Then there are situations where the germ is not dead, it is just well controlled by the immunity, as can happen in tuberculosis. And many years down the line or many weeks down the line, if there's a reason that causes the immunity to lose that control on the germ can recur. So yes, it can come back.
Wow, we're going on a break right now with the first aid segment. We keep this very wholesome, and what you're going to be learning is how to stop bleeding. And then we'll be right back with our two doctors that joined us, Dr. John Wachira, who's a pediatrician, and Dr. Peter Munyu, who is a pulmonologist. There's someone who said lungist. There's nothing like lungist, whoever you are. There's no profession like that. See you shortly. This is Health Check on Hope TV, where you look and live. I'm Kerry Kagiri.
In this segment, we're going to deal with bleeding. Now, the main aim of first aid for bleeding is to control blood loss. Before you get your first aid kit, what you're going to do, you're going to advise your casualty, please support your arm and apply direct pressure. Apply direct pressure and try and raise it up. So when she does that, quickly go get your first aid kit. So put on your gloves very quickly, and then get a dressing and a bandage from your first aid kit. Get a dressing and a bandage from your first aid kit. Keep it close to you. Now, the main idea behind using a dressing in your first aid kit is to cover the wound so that it does not get infected, and it helps also in applying pressure to control the bleeding. So, open it up until you get to this part. This is what is going to go directly on the affected area, the wound. Lift your hand and then place this directly on the wound. Then hold this. Also ask your casualty to assist you in applying the dressing. Then you're going to roll this around her arm, the affected area. Try and spread it out so that it can apply even pressure around the wound. Ensure that it is not too tight as to cut off blood flow in that arm. So flow it around and then tie a knot. Quickly tie a knot there. Tuck this in. Try and make your dressing to look a bit nice and neat. And then we also need to keep it elevated. So you're going to place her arm like that. Okay. You're going to tie a sling using your triangular bandage. So just open up your triangular bandage, the packaging of your triangular bandage. Take it out. And then open it up. This is the right angle triangle. So this point where the right angle is goes on the injured side elbow. And then this part that I'm holding with my left hand goes over the opposite shoulder, like so. And then I start I tuck this in nice and neat. Tuck this in and then bring it to her back where I'm going to tie our knots. Come back, get to the elbow. With this point, what you're going to do, you need to secure this part. So what you can do, you can quickly just roll it out and ensure that you secure it, and then tuck it into the sling, and ensure that you have access to the thumb where you can always check whether blood is still flowing or whether your bandage and your dressing are too tight. So that is how you tie an elevation sling, and that is how you manage a wound on the arm. The same aspects still apply if the wound was somewhere else, either on her leg or anywhere else. The idea is to apply pressure directly on the wound so that you can control the bleeding.
That was absolutely informative for all of us in studio. 911 emergency. Thank God for St. John's Ambulance for that amazing lesson we have learned. We are talking about pneumonia. Pneumonia, now as we know it, is actually caused by bacteria and viruses, and that's why we need to follow everything the government is telling us to do right now will actually help us for most of the part to avoid getting pneumonia. But there are many other issues. With us in studio are two guests, Dr. Wachira, who's a pediatrician, and Dr. Peter Munyo, who's a pulmonologist, and that's a chest specialist. Knows everything about the bronchial and the bronchi.
Those ones.
Everything to do with the lungs. And we must have that. And also our pediatrician in studio, who is also really passionate about pneumonia in children and treating and just bringing forth the knowledge.
Yes.
As we do that, what are these danger signs? We didn't talk about danger signs. Like when you look at this person and it's just run to the hospital or call your doctor.
Most danger signs in children, they overlap between nearly all most of the infection, the common diseases. And we are talking about, for pneumonia, we are talking about this child who is appearing to have trouble in breathing. If they are breathing very fast, or you see like they are struggling to breathe, or they are grunting, it's like they are using a lot of effort to breathe, then that's one of the danger signs.
Oh, no.
And most communities will have a name, a word, a phrase for that.
For it.
Yes.
Okay.
The second thing is that child who has very high fevers and looks very weak. Again, let me say very weak. That's a danger sign.
Mm-hmm.
Child who was 6 months, 7 months, 8 months has been sitting, but now is very weak, cannot even sit. A child who is 1 year, 1.5 years, who has been walking, but now cannot even stand or walk. Or a child who is just sleepy and looking tired. That's a danger sign. Sometimes for children, when they have high fevers, they can even get conversions, which is another danger sign. Or if a child is looking very weak and unable to feed, a child who is eating, most children don't pretend. Many of them will eat. Even when you hear people saying they don't eat it because they took milk or they took some yogurt or they took something else. So that child who is very weak, unable to feed, then that's also a danger sign.
There's something you talked about earlier, and it brings me to this same question. You left your child in the morning. By the evening, pneumonia has killed them.
Not necessarily within very few hours.
Okay.
It will take more than 24 hours.
Yes.
Typically, but
Okay.
it means the child was pretty well. Then you find they got a bit of a fever, a bit of a cough. But by the time when you're getting home in the evening, they have any of those danger signs we have talked about.
Okay. And so that begs the question, how long does it take the pneumonia to manifest completely?
Children have very weak immunity. And within hours, one can get exposed today, and the following day they have the signs. Parents will tell you of somebody came in, they had a cough, a running nose, or some symptoms, and by the following day the child has caught that bug, and they're having the symptoms. So within 1 to 2 days, it can be as short as 1 to 2 days, and it can be as long as even a week or 2 weeks if it's a virus.
Let's talk about the danger signs in adults, especially Men don't say they're sick, they're in pain, they're not breathing, like ankosa, strong, wanaume ni nguvu. What?
Yeah, so in adults, what we find is a few signs. One, if you find a person who was completely coherent, starting to get confused, of course, you have to think about the things we talked about. They are coughing, they have fever, they are sweating, they are having difficulty in breathing. So the moment they start getting confused, that is one of the danger signs. If you find that their urine production is less and they are not able to eat, that's another thing. Nowadays, many people have a blood pressure machine at home, and you find that this person's blood pressure has been 128, so to speak, and now the upper one is less than 90, and the lower one is less than 60. That's a serious danger sign. Then you also, now when they get to the hospital, there are a few things that we may do. One is check, of course, the rate of the heartbeat, if it is above 100. And also we check some blood tests like the urea, and if the urea is going up, that's a person whose pneumonia is starting to affect other organs, and those are bad signs. Yeah.
Our call line is now open for you to call, consult, ask any questions surrounding the lungs, surrounding pneumonia, and surrounding the chest in children and both in adults. We have two great specialists with us in studio. Our call line is right below, and you can call in live. You can also text in on 22232. We'll be coming to your question as we answer this issue of misdiagnosis. What happened?
Misdiagnosis, what you're meaning is that either somebody had pneumonia and the pneumonia was not picked, or somebody had pneumonia and it was called another name, or maybe those are maybe the one. Those may be the two scenarios. There may be others. What happens is the misdiagnosis could be from home. This child could just be having a cough, a fever, sleeping, and then people think the child is not serious or something, or doesn't look that sick, or
doesn't want to go to school.
Doesn't want to go to school. So the parents, the people at home, can actually miss the diagnosis. All could be in the hospital. We mainly use the word misdiagnosis in the hospitals or in the healthcare facilities. Somebody comes in, and because they have an underlying asthma, then somebody assumes there's just asthma. And they miss out, that pneumonia. Or because they may have allergies. They normally sneeze or nose blockage.
So you can confuse it.
Yeah, one can confuse that. So,
Dr. can we pick this call and then get back to this answer? Thank you so much. Edwin in Kitengela, good evening.
Hello, evening to you.
How are you, sir?
I'm good, and you?
Fine, thank you. What is your question?
My question is more so to Dr. Peter.
Dr. Peter, yes.
Yeah, I would love to ask a question in regard to my chest. Yeah, and as I speak, kind of, I most of the times I have pain in my chest.
Okay.
Yeah, and kind of it rotates. It can go to my back, the rear, kind of I feel it inside my other parts of the body, like the armpit,
Yes.
What could be causing all this pain? Let me ask.
Yeah.
Another thing is, late last year.
Go ahead.
Late last year.
Go ahead, sir.
I had similar observation. And I was treated. I went to my doctor and I got some inhalers and all what have you.
Yes.
Now the question is,
yes.
One, and most importantly, what could be causing all this pain? Two,
yes.
How can I differentiate? What could be the difference between the pain I'm experiencing,
yes,
and the kind of the virus, if I may call it so, which is the coronavirus, if I may ask, from that angle?
Yes.
Yeah, because I'm not in fever.
Okay.
I'm not coughing.
Yes.
Yeah. What could it be, please?
Do you have a follow-up question, sir? Dr. Ari? Oh, that's fine.
We can take another one, it's okay.
No, do you have a follow-up question for him? Oh, it's fine.
No, what I would like to say...
Thank you, Edwin.
Yeah, Edwin, what I would like to say is chest pain can be due to very many causes. As you realize, there are very many structures within the chest. Starting from the skin to the bones to the nerves to the lungs, and lung is just one of them. If you have seen a doctor and they have given you an inhaler, it may imply that this doctor is suspecting something within the airway. And it would be a good idea to have a proper history taken so that we know, is this lung, is this airway, is it both, is it other structures within the lung? And sometimes we may need to do some investigations. There are people who have severe pain because of reflux within the chest, and that can also go to the back, can go to the sides. Heart problems also can cause chest pain. So a history would be very, very important, and a proper physical examination. And then the doctor will recommend a few tests if they are needed. Sometimes you don't need any tests for some of the diagnosis if one takes a good history and a good examination. And then you get the right treatment. Remember, some conditions are recurrent. So getting treated in January, for example, for asthma, and asthma actually can cause chest pain, does not mean that that chest pain will disappear forever. You'll find that a few months down the line, the chest pain comes back. And that is why it is important to do a follow-up, especially if a symptom comes back, so that, one, you are informed what the diagnosis is. If there are further tests to be done, they are done, and you're put on the right medication.
Okay.
Now, is this COVID? Well, your problem started last year. At that time, we didn't have any cases, less likely. But remember, COVID is an infectious disease. One can acquire it at any time. So one needs to be careful.
That is true. Yeah. Question, and keep your calls coming in. Our number is right below the screen. You can go ahead and call us. But the question here on our text line is, how are viral pneumonias diagnosed other than clinically and differentiate? Hey, this one I think is a doctor. Diagnosis, how do viral pneumonias differ from COVID-19?
Okay, I think I'll take that one.
Yes, sure.
So, viral pneumonias, the key thing is the history, because many of them will start like colds and flus, what people will call flu. So they'll have nasal symptoms, bit of fever, bit of headache, muscle aches, and a few days down the line, one starts having the chest symptoms in terms of cough, difficulty in breathing, if it is a significant pneumonia. These days, you can do an X-ray, which may indicate that there's a possibility this is a pneumonia. There's what you call an atypical picture. Most bacterial pneumonia have a certain pattern on X-ray. If it is a virus or other germs which are not the usual bacteria, they have different patterns on X-ray. So that can give you a hint.
Okay.
You can also do now specialized tests. You remember I mentioned about DNA tests, or what you call PCR tests, where you take the sputum or other body fluids and subject it to a panel of tests which you look for fragments of the usual viruses available in the country. These tests are available, a bit pricey, but they are available. Yeah.
Okay, David in Isili, what is your question, sir? Karibu sana. Hello, David.
Yes, how are you this evening?
Fine, thank you, sir. How are you?
I'm very fine.
Go ahead. Who's your question to, and what is your question?
I want to confirm, because I have been having some pain on my right side, lower side. What might be the problem?
Right lower side. Is that where the lungs are?
Yeah.
Okay.
Okay. I think your question is similar to what Edwin had asked, and I would follow the same approach to have a doctor look at him, take a proper history, do any test that may be necessary, and confirm. Because having pain in the right lower chest, it could be the lung, could be the diaphragm, could be the space between the lung and the ribs, could be the ribs, could be the liver. It's around there. So a proper history and an examination is what will really help us clinch the diagnosis.
Okay, so if you're calling in and you're looking for these answers, a huge part is for you to go and get a proper full. This is what they also do in the full body check. Like they do the, okay. Okay, even as we do this, we were talking about misdiagnosis, and we talked about it in children and just parents assuming. Can you just talk to them for a minute?
I think if you have a child who looks sick, take them to hospital.
Okay.
If you have a child who is who has been treated and they are not improving, go back to the same doctor, or ask them whether they have someone else who can look at that child in a different way.
Second opinion.
A second opinion, sort of. Or if you are in a lower, we have level 1, level 2, level 3 the facilities, you can go to level 5 or level 6. Again, if you have a child who has a cough, a running nose, whatever it is, stop treating them at home. Unless you know what they are treating. And I would say if they have got like recurrent wheezing and things like that, don't resist using inhalers, because some parents don't like using inhalers or that child who is wheezing. And again, I know we're in the era of shutdown, lockdown. Minimize self-treatment. If you know what you are treating, fine, go ahead. If you have got a wheezing and you normally use your inhalers, go ahead and use them. If you have got an allergy and you know what to use for your allergy, go ahead and use them. But if you've got this cough, fever, it's not a good idea to rush to the nearest chemist and pick an antibiotic because, especially for children, because the dose is totally different. It depends with the weight of the child and depends on what one is suspecting.
Before we move away from that, there's a Bernard in Isili who's asking, do inhalers have side effects?
All medicines have side effects generally, and for a doctor to prescribe a medicine, it means the benefit of using that medicine is higher than the risk of any side effect. But generally, if you're using the short-acting inhalers, again, you are talking about some side effect like some fast heartbeat, or sometimes some tremors, or some restlessness, happening when you use some of the blue or sometimes green cans inhalers.
Okay.
If you're using the other ones that may be steroid based, you may have, if you use them for a long time, or if you, there's some risk of having some oral rash in the mouth. And all this can be minimized if one gets to discuss them with their doctor or with the healthcare practitioner who is giving them the inhalers, because like the thrush, one would be taking water after every puffing, after using the inhalers. And again, if one is having a very fast heartbeat after using the short acting, the quick relievers, relieving inhalers, then the doctor who is seeing them can change or adjust the doses that they're using.
Okay. Julius in Waweru, and this one is to you, Dr. Peter.
Yes.
I am Julius from Waweru. I have pain in my chest area and have been treated for pneumonia severally with no response. How can I get more help?
Now, there are many things that cause chest pain, and some are recurrent. For example, people who have reflux of acid can have recurrent chest pain, and those ones need long-term treatment. People who have asthma can have recurrent chest pain, need long-term treatment. People with heart diseases, especially if you're talking about adults, we talk about heart diseases, those may have chest pain. Sometimes it's just muscular pain. The type of work one does, if it involves a lot of muscular work, lifting and so on, can end up causing chest pain. A history is what will really help the doctor determine what is causing this chest pain and prescribe the right treatment. The treatment may be medication, change of lifestyle, change of the way one does things, change of food or diet. So by seeing a person who is in the medical field, they'll be able to get to the bottom of it and advise appropriately.
Okay, this is Health Check, and you can call in live for any questions you might have to our pediatrician, matters chest and especially pneumonia in children. That's a conversation we're having, and also a pulmonologist who is here to talk about all matters chest and also pneumonia in adults. You can text us on 22232 and you can call in live in studio. We're looking forward to picking up your calls and responding to each and every one of you. Let's talk about diet. Is there a specific diet for children who have suffered pneumonia?
Pneumonia is an infection. And one of the risk factors of getting an infection is the body is not strong enough, the immune system is not strong enough. We say that one of the bad things we find in Kenya is that as many as a third of the children living in Kenya below the age of 5 years, they have micronutrient deficiencies. That means the body doesn't have enough of some of the nutrients that it needs to for its normal functioning. And one of the function is immunity or defense. So it's important for a child to be well fed. You give with all the various groups of foods. Do balanced diet.
Yeah.
Yeah.
Okay. We'll just pause. Don't lose a train thought. Laura from Kandara. Good evening and thank you for calling.
Hey.
How are you, Laura?
I'm very fine.
Sure, go ahead with your question. Who is it to?
Mimi nasikia uchungu kwa chest. And I've been sneezing at night. Lakini mchana mimi sisikii uchungu. Hata sikohoi sana. From August last year.
Okay. Okay, let's respond to that. Daktari, this is an adult.
Yes.
Sneezing at night, pain at night, coughing at night.
Yeah.
From August.
Yeah. So from just those two symptoms, one would think mainly of two things. One is a reflux problem. because it's occurring at night, probably when she's
Can
asleep.
you explain what the reflux is?
Yes, I will.
Okay.
There are people who have a problem in the lower part of the food pipe, such that the usual valve mechanism which prevents acid from flowing into the food pipe from the stomach is weak. And some people actually produce more acid than usual. So what happens is when this person lies flat at night, some of that acid flows along the food pipe and can cause pain, irritation, cough, wheezing, just like a person who has asthma. An asthmatic, on the other hand, at night, that's when for many of them the symptoms come up. So for this lady from Kandara, what I would suggest is we need to distinguish which is which.
Yes.
And in her particular case, a history is very, very important. I think the key thing is if you have a symptom which has persisted,
Yes.
please see someone who is able to take a proper history. We may not even need to do any test, but a proper history and an examination so that we know what is this.
Okay, James from Nakuru, let's come to you. James from Nakuru, good evening.
Yes, hello, good evening.
How are you, sir?
I'm good, madam.
Yes, please go ahead with your question. Who is it to?
Yes, I'm asking.
Yes.
I've been sneezing each and every time. Every time I feel to clear my throat, then I sneeze. What could be the problem?
Can you just repeat that one more time?
Yeah?
Kindly repeat that.
I'm saying
Yes.
I've been feeling to clear my throat each and every time,
Okay.
and then I sneeze out.
Okay.
What could be the cause of that?
Okay,
Could
how
it be,
often?
It's quite wrong,
Okay.
but I've been going to the doctor,
Mm.
and the doctor gave me medicine, and then after medicine, I maybe take some weeks, then it starts again.
Okay.
Yeah, what could be the problem?
Okay. Okay. Thank you very much. We'll be answering your question. Keep it Hope TV, where you look and live. As you answer that question, can we pause and just finish with Dr. here, talking about diet? You said
Balanced diet.
balanced diet.
So balanced diet is what we know, because all the organs need to be functioning and working well for one to be able to fight infections, including pneumonia and COVID.
Yes.
Of specific need to mention is vegetables, because they carry the vitamins, and fruit, because they also carry, they carry the minerals and the vitamins. When you talk about respiratory conditions, you're talking about vitamin C, vitamin A having a bigger role to play. Vitamin C will be found in the orange, like the citrus fruit. The citric fruits they will be rich in vitamin C. So to speak, any colored food that you have tends to have some of those needed vitamins and minerals. So I know sometimes times are hard and one may not be able to have varieties of food, but one should be able to have something different in the course of the week, different vegetables, different fruits, and different varieties of all the food that they're taking. Of special mention again is omega-3. You have got the fish. Fish tends to have some extra nutrients that may not be found in other food stuff. So it's good to also have fish once in a while, regularly in the meals. So those diet would improve immunity for most of the conditions that you're talking about, including the pneumonia and the COVID.
Okay. Ndegwa in Nairobi, Kawangware. Good evening, sir.
Good evening.
How are you?
I'm good. I have a question.
Sure.
What causes, I want to ask the doctor,
Yes.
what causes somebody to sneeze, like me, I normally sneeze,
Uh-huh.
and then it smells a lot. What normally is the problem?
Okay, so it's a sneeze with a scent.
Yes.
Okay. Got it. He got it and he'll respond right now. They'll both respond actually. Thank you very much, Ndegwa.
Thank you.
Okay, let's go now to those answers. We are continuing.
Yeah, I think the questions are related. The gentleman from Nakuru said that he keeps clearing his throat and he also sneezes. And my thought from that is that, and then this problem is recurrent. And every time he uses his medicines, it's better. When the medicines are over, the problem comes back. And in my thoughts, that's probably an allergy problem.
Okay.
It's important to recognize that allergies are long-term and allergies require repeated treatment. So just taking medicine for a month or 2 months may not be enough to bring total control of his symptoms. It's also important when the doctor is taking a history to ask about things which bring on the allergy, the triggers to the allergy, because sometimes by eliminating those in the environment, then one can have control of the disease.
Like pollen,
yes,
cats.
things like pollen, cats, you get rid of these mats in the houses or carpets which have a lot of fluff. Or maybe you are keeping chicken and you are getting exposed to the sawdust and the chicken droppings. All those things need to be sought out, and if they are gotten rid of, one can have better symptoms. Now this other gentleman, Mr. Ndegwa, he's sneezing and he's producing something smelly. One thinks of sinus problem, where he has sinus infection. And in this case, the sinuses may be infected, but if one also has allergy of the sinuses, it can lead to blockage of the tubes which drain the sinuses and lead to an infection. So he may need to be assessed to determine whether there is allergy or not, and then get the right treatment in terms of antibiotics if needed, and in terms of allergy medication as required.
Okay. Question from Mburu Nyahururu. Does pneumonia clear completely for children? We had answered this, but I think he just joined us.
Simple yes. A simple answer is yes. If it's properly treated, it clears completely, but one has a risk of getting it again, after some time, if they're exposed to where those germs exist.
Okay, another question. Could you give us a clear picture of what this balanced diet looks like? I know you said balanced diet, but, can you just say, put a little this, and a little this, and a little this for the child?
Okay, balanced diet, we're talking about a starch, a vegetable, and a protein. So, depends on which corner of the country you're in, because the starches would either be the ugali, the rice, the potatoes, the matoke, the pumpkins. So in any of those would be, you pick one of them. Then the vegetables would be anything green, or carrots, or courgettes, or broccoli, or cauliflower. Pick one of those. And then the proteins would either be legumes or meats. So you're talking about the peas, the beans, the lentils, one of those, and in all the meat, the fish, the chicken, the beef. So one of those. So you pick up a starch, a vegetable, and a protein, and then however you make them, have them done. Then
if you put them all together, like my relatives,
you'll still get something from that.
Okay.
Okay. So that would be balanced diet. But then on the side, it's good to have. We talk about fruit.
Yes.
They may not be cooked with a balanced diet. It's good to have fruit separate as a snack.
Okay.
Yes.
I hear tomato is a fruit. So
Wisdom.
it's in there. Someone is asking to the pediatrician, my grandson turned 2 yesterday. Is it advisable to deworm him? And if so, what medicine, please?
Deworming of children is good, and from 2 years, most of the medicines are safe. If you walk to the nearest chemist, they'll give you a dose of deworming. Just tell them a deworming medicine. Okay. The government facilities will give it to you for free.
Okay. So for a 2-year-old.
Yes,
so you won't give us specific.
I don't want to mention specific.
They're not paid for advertising.
Yes, but when they go to the nearest health facility, government public hospitals will have one.
Let's talk about this balanced diet for adults.
It's the same things, really. But the key thing for people living in towns is that we have to reduce our portions. You'll notice that there's a lot of junk food and a lot of obesity coming up. And therefore, we need to cut down our portions commensurate with what we are doing on a day-to-day basis. For a person who is doing serious manual work, that one can take a bigger portion than a person who sits in the office the whole day. But let's have a starch, vegetables and proteins, plus fruits and water. Please cut down on the salt, and if you can eliminate refined sugar, that would be useful. Also, substituting honey for sugar or the other way around doesn't work. Sugar is sugar.
What?
Yes. There's all this thing about natural foods. And I usually ask, is sugarcane natural? It's a herb actually.
Yes.
But you're talking about sugar. So what you need to do is really regulate how much calories you are taking in, commensurate with the type of activities, physical activities you are doing.
Let's talk about this one. Eunice on Valley Road is asking, is there a vaccination for adults?
Yes, there is. And In terms of pneumonia, there are two main ones. For people who have either pre-existing lung disease or are over the age of 65, there's what we call pneumococcal pneumonia, and there are several types in the market. And for everyone else, right from childhood up to the seniors, we are talking about annual influenza vaccine. Yeah.
So an annual, I've never done that, but just repeat it one more time.
Yeah, so the influenza vaccine is given every year, and the reason that is done is because the influenza tends to change its characteristics every year.
Okay.
So the vaccine I got last year, by mid this year to late in the year, it would have been overtaken by events because the germs that would be in the environment at that time are completely not responding to what we gave last year.
Wow.
Yeah.
Okay, and that's for what age, one more time?
It's from childhood.
From childhood
Yeah.
to...
You do that, John, eh? Yeah.
Yes. From 6 months onwards.
To like forever?
100
Yes.
plus.
No,
So-
100 plus.
Both of you have been
100 plus.
vaccinated for influenza this year?
Actually, some health institutions in this country, you can't work unless you have some of these vaccines.
Wow.
Yeah, because we also get infected.
Yeah.
And we, like I run a chest clinic, you can imagine if I am running around with influenza,
No.
my patients, you get that.
Yes.
Yeah, so some institutions actually demand that you get that vaccine.
Okay, that is very, very interesting. Today we'll be talking about pneumonia, and by the grace of God, we have a pulmonologist who's be talking about adult pneumonia, and our pediatrician in studio who's be talking about pneumonia in children. The one thing I hear being continuously said is nutrition. It's very important for your body to be able to fight these germs, to be able to fight all these viruses and bacteria as well. And also, if symptoms persist, seek medical advice. Don't stay sick continually with these diseases. People are calling and saying from August, others from it's been a while. For children, what would you say? What are the side effects to that?
Generally, all diseases, they are better treated when they are caught early.
Yes.
Because any disease has what you can call a mild, a moderate, and a severe form. And some of the progression is time bound. That means if you come early, it might be a mild disease.
Yeah.
And then if you come in between, it might be moderate. And if you wait for too long, it will be severe. And sometimes you're talking about destruction of tissues and damages some tissues that may be lifelong if you take too long. So all age groups, any sickness that you are sure is not going away within a few days, or even if it's mild, it's always good to get some good assessment and good treatment and follow-up.
Yeah.
Yeah.
Turungi from Kisii. Good evening. Good evening, Turungi.
Good evening to you.
Yes. What is your question, sir?
Maswali yangu nauliza hivi. Nikikula viazi vitamu, nasikia kama mimi nataka kutapika. Hiyo ni nini?
Okay. Asante.
Haya.
Okay. Seems someone doesn't like sweet potatoes.
Okay.
Does that have anything to do with the reflux anyway? It could.
So kuna nyakati mwili inakataa vyakula fulani. So, wakati mwingine ni sababu mwili haitaki hiyo chakula, wakati mwingine ni sababu hiyo chakula inaleta madhara kwa mwili. Kwa mfano, mtu akila kiazi kitamu kinaweza kuongeza acid kwa tumbo, na hiyo inaweza patia mtu hiyo shida ya kujihisi kana kwamba anataka kutapika. Na hapa ndipo tunasema kama chakula fulani kinakuletea madhara fulani, achana nayo kwa muda. Halafu jaribu tena. Kama bado kinaleta madhara, pengine huenda hicho chakula si chako. Achana nacho.
Wow, is it a part of your training to speak Swahili? You just switched up on me. I've been left you alone.
It was meant for Turungi.
I know,
It was good in Swahili.
Wachana nacho kama chakula kinakusikitisha. Ni kipi kikusikitishacho? This is Health Check on Hope TV. We have 5 more minutes, and we're going to pick any of your calls, any questions you might have on pneumonia. Now, it's a very serious disease. We might be laughing in studio, but it's very serious. And if you just joined us, it's also caused by viruses and bacteria. And some of them we've listed, and one of them that the government is working on right now is tuberculosis. The Ministry of Health is speaking so loudly about it. It's one of those that can be caused even just by laughing, because it's in the air, by singing, by all these things. So we must be very careful to know that, number one, pneumonia is not the disease on its own, but they are pneumonia viruses and pneumonia bacteria. Called what? You have named. You said there are many.
Yes.
Okay, there are many. But also tuberculosis and COVID-19
Yes.
can cause pneumonia, which is very severe. Let's talk about when does it lead to death. What is this thing that now causes one to actually fall completely and lose their life?
You can start off by just understanding how the bacteria or the virus affects the body. When the bacteria moves from the environment and gets to the body, if the body is strong enough, it will fight off that bacteria and there will be no disease. If the amount of bacteria is a lot, or the germs is a lot, or the body is a little bit weak, or both, then you find the bacteria gets inside the body. When it gets inside the body, then there will be a fight between the body and the bacteria or the germs. And maybe at that time, there will be some inflammation, there's some tissue damage that's happening, and the body will sense that. If it is a place where you can feel pain, like the throat, then one will feel some pain. If it's a place where there will be irritation, one will start coughing. Or if it's a place that will produce some mucus, then one will have a running nose or some mucus in the chest. Then and that fight will go on. And some, like viruses, the fight may go on for about a week, and then the body overcomes that and one gets well. If the body doesn't overcome that, or it's something like bacteria and it's a lot, within hours, then you have got that bacteria causing so huge damage that the function of that organ is interfered with. You're talking about the lungs now. The lungs cannot get enough oxygen, so one needs to work harder to get the normal amount of oxygen. One needs to breathe faster to get in more oxygen. So you have got more damage going on there. The body is trying to compensate, and all those signs, the body is giving you signs, warning signs that something is not right. Now, if you intervene at that point, you kill the bacteria, you reduce the attack, and the body has time to fight and now overcome that. If that doesn't happen, either no treatment, or the treatment is not adequate, or the germs is too much, or the body is very weak, then you have got more damage happening, and therefore the lungs are made to get oxygen to the body. So when the lungs cannot get enough oxygen in the body, then all the organs have less energy.
Okay.
So the brain can't work, the kidneys can't work, the heart can't work,
and it's a
and then now you progress. Now you're going into failure.
Okay.
Into organ failure.
Okay.
And then from there, then bye.
Let's talk to Isabella from Kitale. Good evening, Isabella.
Good evening to you.
Thank you for calling us. What is your question?
My question is about I have a problem with my backache. Whenever I'm in bed at night, especially during the morning hours, I feel like wanting to get out of the bed. There's a lot of pain at the back. What problem may I be having, please?
Okay, we'll respond to that. Thank you so much, Isabella.
All right, thank you.
Okay, let's hold that thought as we think about what to respond to that. But you are wrapping up just by saying when the lungs fail.
Yeah, when now the lungs can't do their function of getting enough oxygen to all the body. The whole organ works and lives on oxygen. All the organs, for them to work, they need some oxygen to generate the energy that's required for whatever function they are going to do. So when that happens, then you have got no oxygen reaching all the organs. Of course, that is a simplified way of looking at it. There is much more in terms of the chemistry that's happening, the tissues that are getting damaged, the organs, the various organs that are responding differently. But that's basically how one ends up with a death from a pneumonia or lung damage from the infection.
Wow. Okay. We'll see. Is that the same thing in adults? And have a couple of questions. Can I just throw them at you so that you can respond together with what you have? And Dr. please feel free to chime in as well. One says, Nikona, inflammation on my right side. It goes and comes back after some time. What could be the problem?
Inflammation where?
That's exactly what I wanted to ask. If you texted us, your number ends with 707. What inflammation do you have? Where is it? Please be specific even as you send that. Another one says, I have had 2 pneumonia attacks last year, and even now I'm having symptoms. Please help. You can comment on that. And finally, John says, I have back pains and knee pains and a dry throat. What causes that? And even as you take that one final call, because it's about 4 minutes to the end of this episode. Good evening.
Good evening.
Yes, how are you? What's your name?
I'm Sheila.
Where are you calling us from?
From Nairobi.
Okay, go ahead with your question.
Okay, I had an issue. In January, I had chest pain. Then I went for a test. I think it's the ECG test. They told me my heart rate is slightly elevated and my pressure was also high. So I was given some medication and the chest pain cleared. But now I'm starting to have the chest pains again. So I was wondering, should I go back for the same test or what can I do? Because they told me that I have the cartilage was inflamed.
Dr. do you have another question to ask her?
Come again?
Yeah, so Sheila, are you still on the blood pressure medication?
No, I was not given anything for the pressure.
Okay, because if you have chest pain and an ECG shows a change in your heart, then it may mean that the blood pressure problem has been there for a long time. And really one would want to put you on treatment for a long time, not just a few days. There are also things you may do like cutting down on salt, stopping to take sugar, regular exercise, reducing your weight if you are overweight. All those things will help reduce this problem of high blood pressure. Now, if the inflammation was in the bone or in the tissues in front of the chest, where the ribs and the soft tissue attached to the sternum, that can be cleared by certain types of painkillers. So yes, I think you have the right idea to go back and get reevaluated, and the doctor will advise. There's Isabella who talked about back pain. I think she's from Kitale. And if the back pain is occurring in the morning, one has to wonder about the way she's sleeping. Could it be that the mattress has a problem? Could it be that she has an underlying back problem which is worsening when she lies flat? Maybe something like arthritis of the back. So one could look at her bed and see if the mattress is right, whether it is sagging in a way or not, and also have a proper evaluation. Really, most of these things need more history and more examination to determine what it is.
Doctor, can we pick the final call, please? This is a final call of the evening. Florence from Nairobi. Good evening, Florence.
Good evening, habari.
Mzuri sana, habari yako?
Mzuri.
Uliza swali.
Swali yangu, saa ingine nikitembea asubuhi au jioni, mi usikia mzuri.
Yes, go on.
Swali yangu, na saa ingine nikitoka nje, nikitembea nasikia uchungu au ni kama sijua kama unakimbia. Vile wewe usikia unachoka. Alafu kidogo tu inaisha. Sasa hiyo imekuwa imehappen kama mwezi na.
Okay.
Yeah.
Okay. We can respond to that. But I think she's talking about panting and feeling already tired. Doctor, please pick any of the questions. You can go ahead and respond as well. I mean,
it's good that you're having many adults asking questions, and I'm very happy that more men are asking.
Yes. Yeah. Oh, wow. Yes, absolutely. Sure. Go ahead and respond to the in order. But what you could do is this one from Masaki. Just you'll hold on to it as we finish with Doctor asking what's the difference between a bacteria and a virus. You know, we assumed that people know, so you'll answer that.
So there's this gentleman who said that he has had 2 pneumonias and is having symptoms the 3rd time.
Yes.
One has to ask themselves, 1, is this a poorly treated pneumonia? 2, is it really a recurrent pneumonia? Because sometimes you may have a change in the airway that predisposes one to infection. For example, if there's a growth there or someone swallowed something without realizing and it went and blocked one of the air passages, that area can get recurrent pneumonia. That is on the assumption that this person has pneumonia. But there is another condition which is frequently misdiagnosed as pneumonia, and that is asthma. So he needs a proper assessment.
Okay.
I would do an X-ray in this gentleman who is having recurrent pneumonias. If he has any sputum, I would screen him for TB amongst other germs. We also need to find out whether he has diabetes, he has HIV, he has all those things that may predispose him to recurrent pneumonia. Then there is Florence, who has talked about pain and shortness of breath, and also fatigue. from the outset, this may just be asthma. But we also must think about other organs that are in the chest which may do exactly that. And that's where we call differential diagnosis. When we take a history, we try to rule in and rule out different organs within the lung. And heart failure or a problem with the heart is another thing which may give the same symptoms. So a more detailed history would be useful, plus minus an X-ray, plus minus an ECG, amongst other tests to help determine is this heart, is this lung. Yeah.
Okay. What is the difference between a virus and a bacteria? We just went into it like everyone knows.
Both of them are germs. We say that when people get infections or diseases or illnesses, they're either grouped as infection or non-infection conditions. When we talk about diabetes, high blood pressure, cancers, those are not infections. When we talk about the pneumonias, the cholera, the typhoid, those are infections. So bacteria, no, they're just general terms. Simple science, simple biology is just describing what are you seeing under a microscope or other the assessment tools that you have. And bacteria generally will be bigger in size, viruses will be smaller in size. Bacteria will have some commonalities in that maybe they can respond to antibiotics. Viruses cannot respond to antibiotics.
Daktari, my boss is telling me someone has called from Elgeyo Marakwet and they said if I don't pick this call, I may not do this show next week. So good evening, and what is your question?
Hello.
Hello, habari yako?
Mzuri, mimi naitwa Samson kutoka hapa Elgeyo Marakwet.
Karibu sana.
Nimegonjeka tangu last year mwezi wa 8 hivi ama mwezi wa 7 hapo hivi. Sasa nimepura, yani mguu yangu imepura, nikaenda hospitali nikapatiwa nikapatiwa dawa kwa hospitali, nikaambiwa ni pressure. Haya, baada ya mguu kupura, nikakataa chakula, nikatapika, sikuli chakula. Sikuli hata mboga green, lakini saa kidogo nimemaliza dawa ya pressure, tena imeanza tena kupura. Sasa sijui gani inaendelea na mimi natapika kila siku.
Pole. Samuel.
Samson.
Samson. Okay, sawa. Daktari atakujibu hiyo swali. Pole sana, lakini utapona. Utakuwa salama. Asante sana. Okay, endelea watch Hope TV where you look and live. Let's wrap this up. I know we have like literally 2 minutes to wrap everything up, including your closing remarks. Time flies when you're having a good time. Are you having a good time?
Oh, yes.
Okay, correct. Okay, so let's wrap up with those 2 answers for them.
So Samson, ni muhimu uelewe kwamba shida ya msindikizo wa damu si shida ya muda mfupi. Hii ni shida ambayo inastahili kutibiwa kwa maisha.
Na kwa nini alipewa dawa za muda?
Kwa sababu daktari anahitaji kumwangalia tena, hakikisha kama madawa yanafanya kazi vile yanahitajika kufanya, kama akona side effects zozote za hiyo dawa. Na pia huwezi patia mtu dawa ya miaka 2 sababu mambo hubadilika. Ya pili, kama anapata miguu yake inafura, ni muhimu moyo wake na figo pia ziangaliwe. Wakati atarejea kwa clinic, aulize daktari aweze kuangalia kama figo ziko sawa na kama moyo uko sawa. Sababu hii, kama mtu akona shida ya msinikizo wa damu, hizi viungo viwili huwa wakati mwingine zinashindwa na kazi na zinaleta hiyo shida ya kufura miguu.
Tunapoendelea kujibu maswali, tulikuwa tumemaliza bacteria na virus. Ulimaliza?
Yes.
Sawa. So I hope you got your answers correctly. Someone would like to get you for consultation, Dr. Peter. How can they get through to you?
I give my number?
Sure.
Okay, 07999 36699.
07999 36699.
Yeah, my office is in Parklands, Parklands Avenue, a block called Dr. Spark.
Okay. Yeah. So Dr. Spark, 3rd Parklands Avenue. How can we get through to you? And one person is also asked, yes, how else can we get through to you? How can we get consultation? And someone also asked the final question, what causes frequent flu? So you can answer that as you give your contact and you give your last closing remarks.
Okay, frequent flu, this person, we assume that they mean running nose or some nose signs, or maybe some slight cough. When you say frequent, means they are occurring many times.
Yes.
Allergies are the commonest cause to that. Sometimes could be poor immunity, low immunity, maybe because of not feeding well, or alcoholism in their adults, or other underlying conditions. So bottom line, they need to go to a good place, they get assessed, and they will find out why they are getting that frequent flu.
Okay.
How to contact me? Many times, I mean, most simply I'm at Mpisha hospital.
Yeah, that's where I was born. Are you the doctor?
Great. Can go back to the record and see. There's a children's medical center. I'm on first floor.
Okay.
And I'm there in the mornings.
In the mornings.
Monday to Friday.
Okay.
They'll get me there.
Awesome. Get in contact at Dr. Wachira. And final, what would be your closing remark to parents regarding children and pneumonia in children? Okay.
3 remarks. Every cough is not pneumonia.
Okay.
Yes, every cough is not pneumonia. Second thing is any child who is sick and looking sick needs to be taken to hospital and get treated. The third thing is prevention. It's good to do all the vaccination as recommended, especially the ones offered by the government for free. It's also good to think about nutrition, from breastfeeding exclusively for 6 months, and then proper weaning and proper nutrition for children below, having a balanced diet, including what we have talked about.
Okay, thank you very much. And for you, Dr. Hari, as we wrap up, what would be those closing remarks?
One, pneumonia is a major killer in adults too.
Yes.
And therefore, if one has the symptoms and signs that we talked about, fever, cough, coughing up blood, chest pain, difficulty in breathing, if they start getting confused, urine is reducing, they don't stay at home. Let them come to hospital and they be assessed. 2, not every cough, not every flu is an infection. Some of these are due to allergies, some are due to other diseases which are not infectious, and therefore one needs to have a proper diagnosis made. Many people have been given tons of antibiotics which they do not need. And antibiotics are expensive, not just in terms of money, but in terms of the side effects and the development of resistance.
Wow.
Yeah.
Thank you so much. This has been Health Check. We do this every Tuesday at 7 p.m. That's a live show. We have all our episodes on YouTube. You need to catch up with us. Get them, share them. And right now, this show was live on Facebook. So if you want to get all your friends informed, go right to our Facebook page. That's Hope TV Kenya, and click share. When you share it, all your friends will get to see this great information. And I have to thank our doctors, Dr. Wachira, John Wachira, who's a pediatrician, Asante Sana, and Dr. Peter Munyu, who's a pulmonologist. And we'll continue to interact. Thank you so much for your time.
Thank you
We
very
appreciate
much.
it. May God protect you and keep you safe during this season and afterwards. This is Hope TV, where you look and live. This is Health Check. We bring you great specialists. So check us out. The repeat will be on. So keep it. Don't change the dial because you might miss. Okay, have a lovely, lovely midweek. And see you tomorrow morning on Activate on Hope FM, where you listen and live. Bye. Thank you.
Thank you.